Hello and welcome to Medical Dialogues Journal Club. I am Dr. Nandita Mohan, and today I will be talking about a recently published narrative review titled Current Updates and Future Prospects of Periodontology in India. Now, this research that I'm discussing today is being published in the International Journal of Recent Surgical and Medical Sciences, which is published by Scientific Scholar. We have joined with us today Dr. Vineet Kapoor, who's the lead author of this research from the Department of Dentistry, Cures and Care Dental Clinic, Ghaziabad, Uttar Pradesh, India. So, welcome to Medical Dialogue, sir. It's really a privilege to be having you on board here with us today.
Thank you, ma'am. Thanks for inviting me.
Great. Firstly, congratulations on your recent narrative review publication, sir. It's really a privilege to having been the article being accepted. So, if I may ask, how has been your experience with the journal IJRSMS and with your publishing company, Scientific Scholar? How has your experience been?
So it has been a wonderful journey. So it has been always a smooth ride with IJRSMS and our publishing team, Scientific Scholar. Entire team of IJRSMS, right from the pinnacle, Dr. Pradeep, who is the editor-in-chief, and the editors, Dr. Shraddha and Dr. Sohil. They have always given me a opportunity, and it was I'm just following their footsteps. So it has been a wonderful journey. And talking about our publisher, Scientific Scholar, Mr. and Mrs. Seth, their team is fantastic, and our publishing director, Dr. Sunny, he has given me the opportunity, and he has always been someone who I can fall back on and rely upon during my stint as a executive editor also, and as an author. He has always motivated me to write something which is in demand right now in terms of modernization and latest in field of periodontology.
Great, lovely to share your experience, sir. Now, if you're talking about the scope of dentistry, what is your take on that in a developing nation, specifically like India?
So dentistry has evolved a lot in last couple of decades. We have seen a revolution in field of dentistry that is mainly based on increased awareness of the patient. Urbanization has also increased. So patients are accepting the dental treatment because of the new and latest treatment modalities that are being offered to the patients. Coming on to dentists, if we consider dentistry as a whole, so there has increased career opportunities for the dentist also, right from the private practices to the hospital, corporate dentistry, and government jobs. Then there are many more specializations that have come across apart from the traditional specialization. Implantology has taken up the scale, and apart from that, cosmetic dentistry, forensic odontology. So it has been a revolution for the young dentists who are pursuing dentistry overall. And secondly, medical tourism also has increased in India. The patients from Gulf countries are taking advantage of our dental facilities in India. And government also showing interest in terms of research and grants, and academics is also an option for young dental professionals. So overall, the scope of dentistry in developing country like India is immense, and we could see a potential increase in terms of quality of dental education and dental treatment.
Great. So now, sir, what are the major challenges in periodontal education and training in India? Now, since you're an esteemed periodontologist, so you'll be able to throw some light on.
So, see, most of us or most of the general public, for that matter, for our medical fraternity also, they are not aware of the different branches that are there in dentistry. So periodontology is one of them, which takes care of the periodontal tissue. That means the tissue which is surrounding the tooth, so the gums, the bones. So we take care of that. So first of all, there is limited practical exposure. Advanced periodontal procedures are not being conducted on day-to-day routine basis. Only few centers provide advanced periodontal procedures. Then we are still following a outdated curriculum, the microsurgeries, digital dentistry, and these are the need of the hour that has to be inculcated into the curriculum. Then lack of advanced equipments and infrastructure like lasers, CBCT, MIS instruments, surgical microscope. So these are all few challenges that I see when it comes to practicing or pursuing a periodontal education and training in India.
Okay, understood. Now, sir, what role dentists and periodontists can actually play in diagnosing and as well as the treatment of systemic diseases, if we're talking about that in a little bit more detail?
So, periodontal problems share a common niche with that of medical issues. So, we need to understand that uh, if we improve the periodontal status of the patient, there is significant and drastic improvement of overall health of the patient. There is one example like diabetes has been considered, periodontitis is considered as the sixth complication of diabetes mellitus now, and there has been a proven bidirectional relationship between diabetes mellitus and periodontitis. So if periodontitis is there, patient may have increased level of blood sugar in case of diabetes mellitus type 2, and consequently is true, if the patient is having diabetes mellitus, he may have a severe or increased form of periodontitis. Then osteoporosis, rheumatoid arthritis, cardiovascular diseases, they share the common inflammatory pathway, and plus the microbiome which is present in periodontitis increases the chances of atherosclerosis also. There has been reports of pregnancy related complications, low child birth weight. So these are the things that can go hand in hand. If we improve the overall health of the patient, overall we need to improve the periodontal status of the patient. And coming on to the treatment of systemic disease, management of periodontitis is utmost importance when we need to improve the systemic inflammation, and oral microbiome management should be there, and overall rehabilitation. We see a lot of patients with missing teeth and poor oral hygiene. They continue their lifestyle like that only. Improving the overall hygiene and improving in terms of rehabilitation can definitely impact overall systemic health of the patient.
Very well said, sir. Definitely, or if a person has a good oral health, then only it will lead to and good overall health. So that is definitely an interlink that one needs to actually
Yes.
understand and follow at the daily level. Now, sir, you being a periodontologist, can you quietly elicited the latest advancements in the field of periodontology?
So periodontology is one of the field in dentistry that has scaled new heights in last 10 to 15 years, probably in last 2 decades. The one of the most difficult thing in periodontology was to address the disease. For the first time in 2017, a workshop was held in Chicago, and they have classified periodontitis based on staging and grading. So that has immensely helped the periodontist to communicate within themselves regarding the diagnosis and treatment planning of the disease. So things are improving very rapidly in periodontology field. Then regenerative periodontal therapy is one of the field that has revolutionized in last 2 to 3 decades. Now we are using bone growth factors, proteins, for regenerative periodontal therapy. Apart from that, there is a newer concept of minimally invasive surgery, where we use minimally invasive surgical instruments, microsurgical instruments, and microscopes for doing complex periodontal surgeries. Next is the incorporation of digital and AI based periodontology. Use of artificial intelligence has immensely affected the periodontal treatment planning, diagnosis. And lastly, advancement in biomaterials for periodontal regeneration has also improved. We can see many more companies investing their time and money in the advancement of biomaterials to make them simplified, user friendly. So these are the few advancement in field of periodontology, and I feel the future of periodontology in India and overall as a specialization is beautiful.
Very well said, sir. Now, so you were mentioning something about the use of AI and digital dentistry. Now, if I may talk, lastly, if you can just let us know what is the impact of this AI and digital dentistry on diagnosis and treatment planning.
So AI is the need of the hour. We have incorporated AI in diagnosis, treatment planning, then precisely in patient monitoring. So in diagnosis, we have softwares that can detect the radiographic bone loss, uh, particularly in periodontal pocket situations. And then we have salivary biomarkers, AI softwares, where we can do the non-invasive detection of periodontitis. And we do have automated periodontal charting softwares where we can communicate easily. Coming on to the treatment part, we have DSD softwares, we have implant planning software, ortho simulation softwares. So these are the software that help us to improve the patient experience, and as well as communication between the dentist and periodontologist. And apart from that, to formulate a treatment plan which is very conducive and comfortable for the patient. Apart from that, AI is being used in patient monitoring and teledentistry. So AI has a long way ahead in dentistry, and I feel we should all embrace AI in terms of modality for diagnosis and treatment planning for our periodontal therapy.
Great. Thank you so much, Dr. Vineet, for joining us today at Medical Dialogues and talking about your recent review, the latest advancements, how technology is developing even in the field of dentistry, and it definitely has a long way to go. So, thank you so much for sharing
Thank
your
you, ma'am.
insights and talking about your research.
Thank you, ma'am.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.